My name is Adam Lin. I'm the president of iHealth Lab. We're based here in Mountain View, California. And we basically develop consumer-friendly devices focused on mobile health. And areas that we're really looking at is an area of heart health, and two areas for condition-wise is heart disease and diabetes. So we've been around for about 3 years, and I think we've spoken to MedCity a few times, and I think we've been covered a few times as well. So, yep, happy to be here.
Catherine? Happy to be here too. This is Catherine Calarco, and I'm the Chief Marketing Officer with HeartMath. We're very much about helping people to transform their lives through sensor technology, the feedback through an infrared sensor that measures heart rate variability that's connected to a very easy and simple to use app called Inner Balance or M-Wave. And we've been in the business of digital health and sensors for over 10 years, and we basically were part of this Consumer Electronics Show when it was called the Silver Summit before digital health. So I feel very much, it's only been since 2009, but I feel very much like we've got a huge amount of experience in the use and adoption of sensors and being able to create outcomes and research out of it. So it certainly is a pleasure to be with you all. I think we're all in this to create a better world, so it's a lot of fun to be able to talk about it and help each other to create our visions and help other people transform their health.
And Jonathan, do you want to give a quick description of your work as well?
Yeah, so I'm co-founding a company called Gamma Touch, and what we do is we use simple sensors like NFC stickers and QR codes and all those kind of things to trigger a care communicator for, you can see, a simple slide bar up and down pain, emotional status, all through the day, all targeted around patients' normal medication taking behaviors. And so right now we're focusing on oncology patients, and then in the future we'll expand into other indications. But yeah, same kind of thing. We're just really trying to take a more proactive approach to your healthcare, keeping patients out of the ED and have a little more symptom management before it gets out of hand.
So I had a pedometer for a few months and didn't use it, and my husband recently got a Fitbit and has honestly been insufferable about, look at this, and stairs and steps and all this stuff. And so I always like to ask people working at Census if they use one themselves. Adam, do you use one of your own company's products, or maybe?
Yeah, I do. So I'm not sure if you can see this, I wear this every day. So it's our activity tracker. And I think similar to the folks that just mentioned, so we've also, all of our products, basically the apps, so the activity that occurs within the sensor for the activity tracker, so it does two things. One is it measures the sleep, it measures the steps, converts it to calorie burned. So everything iSweep does come over, so I use that every day. So it's I think, how long has your husband been using it?
Just a week, so he's still in the honeymoon phase.
Okay, well that sounds like me first week, and then you'll get the encouragement, then you'll get some discouragement, then you'll get a lot of reminders from other folks how much greater they're doing. So I think that's the attraction of this device. I think it's simple. I think one of the interesting thing about the activity side right now is it's probably the easiest thing to put on. I mean, you hear a lot about wearables. The activity, because it's almost a fashion statement, if you will, on the lifestyle side, that literally when you put it on, it's measuring you constantly. So I think that behavior of putting a watch or bracelet already exists. So I think that's one of the reasons that the adoption of the activities tracker from a behavior standpoint, it's been really easy for people to convert to. Then of course you have this very easy and light way of competing, and also encouraging. So we're actually doing that internally as a company, and some of the services that we see people demanding from us as well.
We're part of a portfolio company in a Columbus, Ohio investor has invested in us, and he was also investing in a tracker, and so we did have an internal competition as well. And there was one woman on the team who was a runner. We were all grateful for Deanna to get our numbers up. So it was a little more sedentary than Deanna, but that was, I could definitely see the competition dynamic in that experience. When I was at CES, I met Catherine there. I tried that Muse headband, and it fits over your forehead, it goes behind your ears, and it's also for managing your breath and your stress level. I was interested in HeartMath too for that reason. Do you use HeartMath or any kind of fitness tracker, Catherine?
Yeah, I use HeartMath's M-Wave and the InnerBalance stress management tracking and training device daily. So I use it in the morning 10 to 15 minutes and at night to help me sleep just before I go to bed. So, and it's amazing. You start off thinking that you're handling everything. You're not really seeing what's going on inside of you. So HeartMath helps with that anchor for behavior change. So we help people manage their emotional response to stress. And that helps you to make better decisions. You actually then get up and take a walk more. You're more compliant with your medicine. So it's really this deeper technology that's proven and effective. We're based on 20 years of research, and it's easy to use. So this is the sensor goes on your ear like this, and I use it for 10 to 15 minutes. But I also, this has helped me with using, I've got a watch, and you can see I got a watch tracker, and I'm wearing the Fitbit on my waist. So
you're all hooked up.
I'm all hooked up. So I think my stress management with the InnerBalance and the M-Wave has helped me to maintain using the tracking devices through the honeymoon period and into the let's get some outcomes period.
Nice.
And Jonathan, I know you said you were taking a short course of medicines. Do you use any fitness trackers? Since obviously, hopefully, you don't need your own device.
Yeah, no, actually, it's funny, you know, being in like the tech space and everything. I think my problem is I want all of them. Like, I think all these things are so awesome, and for one, I don't know which one to pick, and then number two, being an early stage startup, I mean, I can't go buy them all, you know. So it's like I have to really do some research, and so I think where I would use it personally is more in the workout setting. Have you guys heard of like the Mio Alpha watch? It checks like the heart rate and your respiration and all that kind of stuff. Because I've done like the heart rate monitor around your chest and all that stuff while you're doing a workout, and I know it's okay, but it's weird having like a big piece of plastic across your chest, you know, while you're doing stuff. And so everything that's getting smaller and smaller now, it's just like the wrist, like you said before, Adam, with like it being a fashion statement and it's functional and it's just simple to put it on. I think that's if I were to use something, that would be definitely the way to go. Now, as far as other things, I do use like some workout like apps and stuff like that that track fitness in the gym. Your workout tracking. You can see charts of your graphs. I mean, I'm kind of a nerd like that. I like to see my improvement over time. I like to see how my friends are doing, so it has a little competition to it. But that's about the extent of it on our side over here.
So Alex Fromeyer just joined us. Yay! Fourth person.
Sorry, I'm late.
Alex runs BeamBrush, which is a smart toothbrush, but he's also working on something called the Tile. Are you willing to talk about the Tile today, Alex? Is it too soon for that?
Yeah, we can at least touch on some of the themes around Tile. There's not a ton to say yet, other than we're hunkering down in the R&D labs on it. But yeah, happy to talk about some of the themes and the approach we're taking with it.
So everyone has been talking about how you all have all these data streams, but no way to consolidate them or to put them all together or show your doctor. And so Alex is actually working on something that might enable that. So I wanted him to talk about that.
Yeah, and that is probably the most interesting thing to me about Tile at this stage is, if there's one problem that I keep seeing over and over again in the digital health discussion, it's that we have all of these disparate data sets. Many of them are accomplishing the same thing. Like, I wear two trackers that are both counting my steps, right? So you can spend all this time collecting these siloed data points, but something needs to begin to tie those systems together. And there's two ways to approach that. You can ink deals with all of the great data collection devices we have and start to build analytics engines to tie those data points together. Or you can start to do devices that bring that collect multiple different streams of data together at once. And so that's kind of the approach we're taking right now to see if we can, at one time, collect multiple different types of data related to cardiovascular health or diabetes or obesity, and then be able to provide that for ourselves and for others at the same time.
And Adam, I think as I was talking with you last month, you were saying that some of that's coming up in the future for iHealth Lab is getting the data from the different different sources together from your devices. Is that right?
That's correct. So, I mean, I think it's really about insight and context. So, as you know, whether it's an activity tracker or for us, a focal point is getting blood pressure results, getting blood glucose results, and as I mentioned earlier, our focus being heart health and heart disease and diabetes, and really there's an interrelationship between those conditions. So it's, I think the user, you know, what they've done is put in the effort of tracking, right? I mean, I think everything starts with that number, but what do we do to help them understand and to guide them along the process? Whether that's in collaboration with a healthcare professional, or in this case, where we can make sense of multiple vitals that comes into play. We have a lot of users that actually use not just one of our devices. They literally would buy 2 to 3 devices at once. So users that would basically purchase a blood pressure monitor, jump on a scale, and again use the activity tracker. Well, those are 3 awesome vitals if we could make sense of it for them, right? The correlations and relationships of weight gain or weight loss, or lack of, or even none, and also the changes within blood pressure. So I think that's where we're beginning to sense that I think the users have taken the first step, which is actually acquiring these devices and saying, okay, I'm going to take the initiative for whatever reason, because most of these people do have some condition or precondition, and they're going to actually take your vitals. But then now as they do that, there's a real demand to say, look, I need to start making sense. What does it mean? So I need a little bit more just the trend. I need some aspect of telling me maybe to correlate with things outside of those 2 vitals. So something like I can imagine HeartMath, where we're looking at lifestyle-related stuff with stress. Stress is a very big indicator. Sleep as well. So those are the things that we're going to be doing for 2014, is not just have new devices, but really on our app and our cloud side, it's really making sense for people on software.
Yeah, that's really important. HeartMath is dedicated to not just monitoring, but also providing immediate feedback to help people shift in the moment. Because a lot of things just track, but it doesn't really help to create more of a coaching moment. So HeartMath's application actually builds the 2 together and gives that real-time intervention. And we've just launched a cloud system, you know, so we should talk about connecting the 2 data points together. But the cloud system we have over 300,000 users, so we're seeing 800,000 points being earned a day. So that is really meaningful. So what can we do with that information to help people to meet their goals and manage their stress and achieve what they're trying to do?
And I know that iHealth Labs is working with some doctors to see the effect of tracking blood pressure measurements on a more frequent basis. And Catherine, one of your products it has more of a provider focus. Is that right? That a doctor would say, here, you should use this to an individual?
Yeah, that's correct. We have about 15,000 health professionals that use our M-Wave technology, and they're trained and with protocols to actually work with their clients and people and patients. And so what they do is they have the software program, and then you can share your sessions with your health professional. So they can take a look and see how you're doing, and then provide you with advice and other protocols to help you to actually transition from everything from standard stress and anxiety to things like pain management is a big one, sleep, and also serious things like PTSD and other effects that we see within the VA centers.
And John, I know that you're working with doctors closely. Is there feedback you've gotten from them about getting this data? Because I know, certainly digital data is better than just a handwritten diary, which has been the model up till recently. Is there anything that they've said, we'd like it to do this, we'd like it in this format, or this kind of frequency? Any kind of feedback there you could share?
Yeah, so right now, like I said, we're launching this pilot. We have some guesses of what we want this to look like, but until it really gets in the hands of the doctors and the nurse navigators, we really don't know. So one thing that they do like and that they would like to see is the ability to track each patient's symptoms over time, so that each patient has their own trend line. So say I use my tool once a day, and my average pain scale is a 5, whereas Sally's using it once a week and her average pain scale is a 9. So there's at least a trend line, and any deviation thereof can be alerted. So it really helps triage these patients, because right now the way it works is that how the touch points go with the patients, they really just pick up a phone and call just a list of patients, and you have to talk to this many per day, and there's really no rhyme or reason to who they call when. You know, I could be fine and I could still receive a phone call where so-and-so could be feeling pretty crappy, and I get just as many phone calls as she does, you know. So that's one thing they can see, like red flag, some kind of a system that can point out who needs care and needs those touch points compared to others. So that's a big one right now.
And Catherine, with all the data that you've combined, does HeartMath do any kind of big picture analysis, or do the individual practitioners look for trends? Or, you know, certainly you can't make one size fits all solution, but are there any big picture insights that you found from all the data that you have?
Yeah, we have several research studies that indicates where their heart rate variability should be for their age, but we have not. What we don't do is we're an education device. So what happens is that the physician or the health professional, if you can see this, will look at the data and from the individual and actually assess how they're practicing, how often they use it. They'll look at the heart rate variability pattern, and they'll be able to ascertain, well, maybe some other techniques and in concert with the journaling, how they can actually improve the effectiveness and towards their goal of either reduction of blood pressure or dealing with sleep issues. So we are looking at big data solutions on how can we create more information to help people, compare them with their colleagues or friends, or create groups. We're also looking at how we can integrate with other data sets. So you might say, wow, I'm not running so well today. Oh, and my stress management levels, I'm not as able to be coherent today. So might be a relationship to either overtraining or things that are going on in your life that you can actually then rebalance and refocus and help yourself to enter that more positive emotional state. So we believe that through looking at the trend lines with the health professional, that you'll be able to fast track the results. And we get data every day from people going, oh my gosh, you've saved our life. I have better communication. I can sleep better. And we've seen outcomes, everything from improving test anxiety to reduction in blood pressure. So it's phenomenal, the impact of it. And we're just starting on what to do with the big data side.
And Adam, that's part of the study that you have going on now, is helping patients see their own trend lines or maybe recognize them better. Is that right?
That's correct. So, I mean, I think what again, going back to really what we're beginning to find is a real demand, you know, where it's not enough just to track. I think people are beginning to realize, I mean, we started this 3 years ago, so we were early, I think. I mean, 3 years ago, we were like one of the really early device companies, at least on the mobile health side. And we're beginning to sense, I mean, people have been with us for over 18 months. And even looking at usage right now, a lot of people who are using our blood pressure are actually using the device more than 4 to 5 times a week. And what you'll find is people who are hypertensive, doctors would literally tell you to use it maybe at most at times as a measure once a week. So we're seeing really engaged users. So again, as stated earlier, as we see people beginning to say, well, there's so much more than just blood pressure. What is affecting my blood pressure? You know, I think the holy grail of everything is probably food. If we start really figuring out food, but then it's food intake, it's the results of the weight, and people are beginning to really understand that. So we also work with the enterprise community now, where we're trying to aggregate those data points. So the uniqueness of chronic diseases that people are looking at, which is really preventive medicine. I mean, those are areas that we can really try to treat. So as more people are in tune to understanding their vitals, hopefully understanding those vitals will allow people to make lifestyle changes, because I think that's what it comes down to. So we are partnering with providers. We're doing studies right now. There's a study we're currently doing with UCSF that we're probably going to be getting results in a couple of months. And so far, it's extremely positive. And we do those studies for really 2 things. Number one, we want to understand outcome. We want to see the effects of people's usage and the results. The other thing is we really want to understand behavior. What is happening when people use these devices? You know, we drink our own Kool-Aid, right? I mean, we think it's the greatest thing. But ultimately, the user /patient/customer they're the ones telling us. So I think that's where we're headed, and you're going to see a couple more studies coming out from us this year as well.
The Kool-Aid is delicious, though.
We like it.
That's right.
So Alex, your product, the Beam Brush toothbrush, is designed to help people with an everyday thing. Everybody, not just people with heart problems. So I know you've done a couple, I think, pilots with Delta Dental. Is that right? Do you have any insights on that sort of daily health habit?
Yeah, so one of the most interesting things that we've learned is actually taking our daily data, which is oral hygiene, something that everyone does, and figuring out how to apply it to other data points. And so we're starting to link up oral health data alongside our cardiovascular data sets that we've been able to procure, which is interesting in its own right. But what we kind of revealed from our Delta Dental pilots is that people using the Beam Brush are about 30 to 50% more likely to brush their teeth that dentists prescribe 2 minutes twice a day. And that's an early sign that we're having at least some effect on the behavior of the average user. And so as we start to get bigger data sets and better understand how those are maturing with our demographics of users and also doing that in higher quality ways versus the norm, we can start to see if we're really able to impact daily hygiene behavior. And if that's true, and if we can show that our sensor and our apps are helping to make that change and also describe the value of that change, that's where we can really start to take our data to the dental insurers and to dentists and affect treatment planning and the patient education process, which is what we're really after.
So as I was thinking about our conversation today, it seemed like an RSS reader is the format, and I know not many people use RSS readers anymore. And being in publishing, of course, I still do. So you can put all your feeds in one spot, so you can see all the headlines from 10 sources in one space. And it struck me as that's sort of like a good model for a personal health record or even a data tracker. I mean, I think some of the elegant solutions is like the trackers where you can put your tracker on top of your tablet or your phone and it syncs right away. I wonder if there are other examples of form factors or good designs that will push all of this stuff into the mainstream. Catherine, do you see anything along those lines of good design or good interface? Besides HeartMath, of course.
Yeah. We've looked at a lot of the platforms that are trying to aggregate right now, and many of the like the Fitbits and others are actually partnering with data and allowing you to have badges within their platform. And we're also seeing insurance providers doing the same thing. So they're trying, like CarePass is trying to do that. I think people are still trying to figure out the design and presentation of that data, because one is to actually have it there, and two is to make sense of what it is and what it's actually telling you. Because if you're training for a triathlon, it's very different than if you're actually trying to manage diabetes. So that having the same data presented to you it may not give you exactly what you want to actually affect the change. So we like the design of our Heart Cloud. We think that is the way it's represented is unique and also provides a lot of information. Personally, I think that there's a lot of similarity out there, and I think it's an emerging field. So I'm pretty pleased with the way it's going, but I would like to user customization, so the ability to have it look the way that it's meaningful for you, or have the data that you want to have together. And the 23andMe way that they operate was pretty amazing, what they were able to show people and how they were getting groups to help each other not only see the data but manage their behaviors and their diseases and learn to move forward. So I think enabling the patient is profound, but it also requires an intelligent system that supports that without disintermediating what they may need from a health professional or the physician network and healthcare. So it's a balance, and I think the design right now is is just trying to get the information presented, and it hasn't built in the intelligence yet. But we're headed there, not too far away.
John, one thing that I remember from the presentation in Nashville is Joanna said, "Are you taking your medications, or are they just banging around in your purse?" And I thought that was a really good illustration of the challenges of getting people to take their meds, because, yeah, they are banging around in my drawer, in my purse, whatever. So are there form factors that you think help get over that hump of, I don't usually do this, and how do I make it fit into my daily life?
Yeah, that's the big challenge, right? You're not trying to completely change behavior. We're trying to modify the behavior, right? So that's why we're attaching our little, RFID stickers to the pill bottles and to your bathroom mirror and places that you are normally. We don't want to put it in the garage under the tool belt, whatever. Just something that's not going to change your behavior that much. And that's, it's like, as you all know, I mean, even changing a little bit of behavior, putting a device on, doing this and that, it poses a bit of a challenge. But if you can just get over that hurdle, it opens up a whole new world of data capture. So that's what we're trying to make it as just as dumbed down as possible. And hopefully that these behavioral modifications that we're trying to get people going with, doesn't break the bank. So yeah, we're still, like I said, we're still in the trial phase. So getting to the bottom of it is key for us. I think we're going to look at a lot of you guys, but you guys do too, because there's a lot of information out there and success points that you guys have found that work pretty well. So we're definitely still doing our homework.
I remember reading a diabetes blogger. Some of you may know her. Amy Tenderek does Diabetes Mind. And several years ago, she had a contest to develop a better insulin pump because they were big and ugly and clunky. And certainly I understand the appeal of good design, but I never thought about it in terms of medical devices. And Adam, that's certainly something that iHealth Labs has done, make it look sleeker. And are there design lessons you all have learned over the years to make it look just like something that should be in your purse and not like some horrible medical thing that no one wants to deal with?
I think that's it. I mean, I think we're all taking a page out of Apple, that the aesthetics and the form factor of a device makes a huge difference. And I think oftentimes when I talk to people about that, saying that, look, iHealth is looking to develop cool and innovative products, solutions, one of the things that we really hone in on is experience with the device itself. Oftentimes I'll get a feedback that, oh, that's for the people in the coast, that's for people who in the Bay Area, the younger generation. Well, it's actually not true, and the reason is we actually are engaged right now with we're going to be launching a project this year in which we're going to actually, our solution, and I call it our solution, it's not just a device, it's the app, the cloud, our integration with this provider into various chronic disease programs. And they've actually been around, and they've actually been using other devices to provide to folks. And the people they're actually going after are people who are 70 and above. So these are not the younger generation who we think are the iPhone and iPad users. These are people who are older. And as we were getting into our discussions early on with them of why they wanted to work with us, besides the fact that we really had a holistic solution from a blood pressure scale, activity, glucose monitors, really bought in on the message of heart health, and the ability of having an API that allows us to transfer the data over, which is critical. One of the things they got feedback from, because I asked, I said, so it's great, but what other reasons are you picking us and talking to us? And one feedback they got from their users, the people they were pushing out to, their services, is the device and the way it looked mattered. And they actually, through the programs that they laid out, they realized that they went into people's home, taught them how to use it, but they really look like personal medical devices. And it really scared them. So they'll do it for like a week or a month, but it was just not personal. So they've learned the hard way too. So, and we've already been learning this ourselves in the past 3 years. So I think the form factor, it's not just to look cool, but it's to be personal. So again, I think this is, in some sense, we learned a little bit from what Apple has done really, really well, and that matters. So I think the whole idea of whether the data should be separate and should have someone to integrate, what we found is people are looking for a personal solution. And when they think about solution, they actually do not separate the device. To them, it's I bought a device, and it's almost like the Internet of Things, if you will. I bought a device, and the data, the origination of that data comes from that trusted device. And now my demand from you is make sense of it for me. So this is where we really see the opportunity.
So we're getting close to the top of the hour, and I really appreciate you all persevering and making this Google Hangout work. Thank you very much for making this happen for MedCity News and everyone else. I thought it'd be good to close with either a hope or a prediction for 2014. So, John, do you want to start with that?
Hope for 2014. We were just up in Boston talking to a lot of folks from Blue Cross, and hearing their problems and needs, and this whole delineation of this healthcare system the way it is and how it's just basically broken. What I can hope for is that more groups like all of us here, come together and really get this more proactive approach to healthcare. Because the way the shift that it's going is that these patients are going to be on their own more. You're not going to the doctor's office as much anymore because doctors are now having to pay out of their pockets for your care with this new capitation payment system, and so we need more tools like ours to persevere and push through and fight those questions of we're dealing with oncology. We always get the most of oncology are the 75, 80-year-olds. How do you deal with that? And it's like, well, we're not building this product for today. We're fixing this broken healthcare for tomorrow. And so I think that focus on the future is our hope for this year.
Catherine, what about you?
Yeah, I think this year is going to be got a bit of an echo.
No, let me mute.
I think this year hopefully is going to be a transformational year in the sense that we're going to move beyond fitness trackers for high level of adoption and move into all the other things that are life-changing, so that the understanding of things like all of our products will become more ubiquitous and more easier for people to adopt. And I also hope that we end up with we're working on this, getting the health system to pay for wellness rather than for the emergency room. So we want to see more innovation on that side. And the last thing for us is we want to continue the work that we're doing to transform people's lives and to live to the purpose of the company, and that means collaborating and partnering and licensing and making it easier for this entire industry to thrive. And so we've been at it for a long time, and we are really excited about this year. Digital health is now an industry. We are now here, and we're creating outcomes, we're making things happen, and we're changing healthcare. Yes, we're here changing healthcare. And it's all of us have to work together to make that happen and to make it easier for us to get a huge amount of people using our products. So that's
that paying for wellness, that's a hard one. I hope that really gets traction this year as well. Alex, what about you?
I think my prediction is quite simple, and it's already been touched on multiple times here. I think 2014 we're just going to see a lot more data partnerships. I think we're going to see a lot of device makers and some of our great pieces of software that have started to gain traction in the market are going to start marrying up their data sets with one another and to one another because consumers are demanding one-stop shop personalized health data. And so since that demand is there, I think we're just going to start to see more of that integration happen.
Yes, I think I've heard integration more often in the last 6 weeks than I have all of last year, so everybody's feeling that it has to work somehow. No more silos. Adam, do you want to finish our conversation?
Yeah, I'll make two simple predictions. One is from Catherine's side. I predict this year will be about mobile health and not about mobile desktop, and we'll be getting more discussion in that area. And the second thing, I think within the people like this panel, you'll see a lot of collaboration occurring. So that's my dream for 2014.
Yeah, well, working together and having more healthy people and fewer sick people, that sounds good to me. Thank you again so much, all of you, for being with me, and this will be up on YouTube later today.